Are you looking for a space where you will learn to improve your mental strength, emotional health, and heal your insecurities from the inside out? Take the first step to living a more meaningful life with the Better Me with Body by Bree podcast. I'm your host, Bree. I'm a certified personal trainer, entrepreneur, and mother of 3. I've helped empower thousands of women to take action through fitness, nutrition, meditation, personal development, and aligning thoughts with action. This podcast is for those who are ready to feel inspired and motivated to live a more purposeful life. Let's grow together. Hi, everyone. Welcome to the Body by Bree podcast. And I'm so excited because I have Dr. Chittister here with us, and he's an amazing plastic surgeon located in Utah. And he's growing like crazy. I don't know if it's all of your awesome TikTok videos, Dr. Chittister, or if it's your amazing educational content or just how fun you are and how personable you are. But he is growing like crazy, and he is here to share all of his knowledge with us. And this segment, I'm calling it Ask a Plastic Surgeon, because I want to cover and tackle all of our questions that we have had as my clients and my followers and my friends, my mom friends. Are you ready, Dr. Chittister?
Yes. And honestly, Bree, thank you so much for having me on. You're so awesome. I'm glad that we were able to connect, but thank you. I'm excited. I'm ready.
Okay. I'm so excited. So would you mind telling everybody just a little bit about your background?
Yeah, for sure. So like you mentioned, I'm here in Salt Lake City, Utah, where I have my own private practice plastic surgery office. But kind of a little bit about me, where I came from. I actually grew up overseas. I grew up in Saudi Arabia. My dad's from Utah. My mom's from Thailand, but I grew up overseas. And then I moved back here to Utah for like high school. And that's where I met my wife. So my wife works in my office right now. We work together. So we've known each other for a long time. And so I ended up finishing school here in Utah. And then I went to do my undergraduate degree and medical school at the University of Utah. So I stayed here for like 8 years to do that. We had a couple of our kids, and then we moved to Southern California. So that's where I did my plastic surgery training. I spent 6 years at Loma Linda University. So that's just east of LA, about 60 miles.
Awesome.
And yeah, so I was there. I did my plastic surgery training 6 years. Then I went to USC in LA for a year. And that's where I did a lot of complex hand and orthopedic upper extremity stuff, which I love. I still love to this day. And then it came back to Utah. So it worked out. We were actually planning on staying in California and setting up practice there, but things worked out and we came back here to Utah to be closer to family. So I'm a board certified plastic surgeon back in Utah and just loving it.
So one thing I love about you, Dr. Chittister, is you're so open. If you guys don't follow him, you should, because he will answer. He's constantly saying, hey, ask me questions. And he'll just get into the nitty gritty of everybody's questions. He even films a lot of his operations, which I love. I'm weird like that, but I love to watch the process, and I love it. I love that you just kind of are candid about everything. And a lot of my followers are, stay-at-home moms, and the whole plastic surgery world can be very intimidating and scary and maybe, in their minds unnecessary. But I wanted to kind of just talk about it. I wanted to ask my followers what questions they had and just ask an expert on it. So when I asked a lot of my followers what they wanted to ask a plastic surgeon, a lot of the questions were centered around surgery after having kids. And we all know how hard that process can be for us as moms. And I never want women to feel like they have to get plastic surgery, but I also am not against a woman wanting to feel her best and take care of things that have been, stretched out and torn apart. And like, obviously I'm a personal trainer, and I believe that you can do a lot to improve your body with hard work and the right nutrition. But there are also some things that you cannot fix on your own. It doesn't matter how hard you work out. For example, you can't fix loose skin. And sometimes diastasis recti is you have to actually surgically, sew your abs back together, or umbilical hernias, or sagging breasts. Like, let's chat about some of these topics and just kind of weigh in and see how you your thought is on all of them. So my first question is, how do you know when you need to get surgery to repair your ab separation, or also known as diastasis recti, or when you can fix it on your own through exercise?
I love that, Bree, because this is seriously one of the most common questions I get. And, you had mentioned, I mean, I think what you do is amazing. I mean, you really are empowering women, who have either had kids or postpartum or all that stuff. And my sister actually did some of your postpartum program. She loved it.
I love her. She's the best.
Yeah. So, I mean, you do things to help women, and I love that. And the question I get from these same women is, I've done everything I can. Like you said, I'm working hard. My nutrition status is good. I'm in a good mental space, but, I have this extra skin, or like you said, the diastasis recti. I felt it improve, but I feel like my core is still it's not the same as it used to be, or they have back pain. And so that's what I tell a lot of women is, look, if you have a diastasis recti, and there are ways that you can kind of assess it yourself to see how wide it is, but usually if it's over about 2 to 3 centimeters, so if it's wider than that, a lot of the exercises that you do on your own just can't get it back to normal, and so, and many women, after even having 1 or 2 children, their diastasis is like 4, 5, 6 centimeters, and we're talking a few inches. And so that really can weaken your anterior core. And obviously, all this fitness stuff. And so, when the core is imbalanced like that, it just makes it hard for women just to even sit up, to get out of bed.
Yes.
And so that's when I advise, like, it's worth considering if you're thinking of getting it repaired, when it's about that wide, it can definitely help improve your core alignment and all that.
So is there a certain time that I've heard people be like, I get this question a lot, is like, I had twins, I have a big gap, it's been 3 years. Is it too late for me to repair it?
Yeah, no, it's not too late. The separation, if it's like that wide, especially after twins, it's not too late. But what I do tell patients is that over time,
I mean, like on their own, like to bring the abs back together on their own. Is there like a certain amount of time,
Gotcha. Yeah, I usually say within the first 6 months. So, after you've the baby weight's kind of come off, you're able to get back into a regimen of exercise, and you're doing those core exercises to try and build up your muscles. If after about 6 months, you're not noticing a difference, then I definitely say it's worth, talking to a plastic surgeon or someone to see if it's something that can be addressed surgically. That's what I usually say.
Awesome. Yeah. I remember when I came home from the hospital, I could fit my entire fist in between my ab separation.
Oh my.
It was 4 fingers wide. It was insane.
Wow. But it sounds like you've repaired it, yeah.
Yeah. Well, I mean, it's back down to like 2, a little less than 2 fingers, which I can feel it, and my core is weaker, but it's not to the point where, I feel like I have to sew it together. Like that doesn't bother me, but some people, like my sister's is 3, 3 fingers wide. And so that really bothers her when she's trying to work out. So, so why would somebody want to repair their diastasis recti if they can't bring it back together on their own? What would be the benefit of having the surgery?
So I think there's 2 main benefits. There's a functional benefit, and there's also, I wouldn't say cosmetic, but like the appearance of it. Because some women I've had come up and say, look, I do everything to strengthen my core, but some people come up to me and say, oh, are you pregnant still? And that is like, for one, you can't ask people that. That's not fair. But 2, you kind of have this fullness in your lower belly because the insides are kind of pushing out against the outside. And, when the core is separated like that, it really does kind of distort the abdomen and makes it look a little more full. So that's one of the reasons. But then also, again, functionally, when your core is realigned after a diastasis repair, you're offloading your back, because now you're not relying just solely on your back to hold up your core, but the front is also helping out. And so that can also help with things like back pain and other issues that people have. So functionally, that's why people would want it repaired.
Definitely. So can you repair diastasis recti without a tummy tuck? Is that possible?
Yeah, there's actually a few good options. And it solely depends on each individual, because they may, the tummy tuck, there is definitely like a taboo, or like, oh my gosh, extra skin and fat. But really, like I said, a lot of people just need that diastasis repair, and it's affecting them functionally. So there are ways to have smaller incisions and still repair the diastasis. It's almost, I tell patients, it's kind of like a low C-section scar type of an incision, and we can use that to repair the diastasis.
Okay. And then how soon after you have kids can you have a tummy tuck or a mommy makeover or fix your diastasis repair?
Yeah, a lot of surgeons are different in their recommendations. For me, I'm probably a little more conservative because I really want women, like you had mentioned before, being in the right space, being, where they feel, ready for something like that. And so I usually say at earliest 4 to 6 months. If women are breastfeeding and things, usually want to be done breastfeeding and not producing any milk any longer. And the same with the muscle repair. Like I said, if it's been 6 months and everything seems like it's come back as much as it can, then at that point you'd be a candidate for it.
Right. And I would think like even after the trauma of having a baby, like let your body recover before you go through another surgery,
No rush.
Like that would be, yes. Yeah. So would you suggest making sure that you're done having kids before you have that surgery?
100%. I tell patients, if you even have 1% chance in the back of your mind that you want another child on your own, then I would say wait. Honestly, there's a couple reasons for that. One, I think, it's not the end of the world. Let's say you had a tummy tuck and then you had another pregnancy. It's not the end of the world. Your body will still stretch back out and do what it needs to do. But I feel like it's just kind of a waste of your money. I tell patients, like, why would you do it and then stretch it out again? It's kind of a waste of your time and money, in my opinion.
Yeah, definitely. So, okay, along with that, what can you tell us about umbilical hernia repair? Because that's another one that a lot of my friends and my clients have dealt with.
It's very common. Yeah, it's very common after pregnancy. And here's what because a lot of women don't have that before they have kids, but your belly button, as we know, is a scar, right? It used to be your umbilical cord and all that. There's a ring. It's called the umbilical ring. And that's actually small. But then when you have a baby, it stretches out. So that ring gets bigger. And that ring allows for this hernia stuff, kind of the inside contents of your belly, to kind of poke through because that ring gets stretched out. Mm-hmm. And so I see a lot of women come in because they have a big diastasis, the muscles are separated, and then that ring is stretched out. Women get umbilical hernias. So that can be repaired at the same time as a tummy tuck and a diastasis repair.
Got it.
For the most part, yeah. Some women need mesh because the hernia is so large, but that's something you'd always want to talk to your surgeon about before surgery.
So what if you just had an umbilical hernia? Could you repair just the umbilical hernia?
Yeah,
or most of the time would they have the ab separation with it?
You can do it by itself, or you can do it at the same time. That'd be something you'd have to talk to someone like me or another surgeon about. But yeah, it can totally be done separate or together.
So can you live with the umbilical hernia? Does it hurt you? What happens if you don't repair it?
That's a really good question. So there's different types of hernias. So some hernias are just some of the fat that lines, your intestines, the padding. That stuff sticks through. And if that comes through and goes back out, that's not a big deal. What the concern would be is if you actually have some of your bowels or intestines that kind of poke through and then get stuck, that's called an incarcerated hernia. So incarcerated hernias need to be repaired. And so the size of the hernia can make a difference. So the bigger the hernia, a lot of times it's less likely that you'll have incarceration. But if it's smaller, you don't want to get something stuck in there. So most women, if you have a hernia and if it is a little bit tender and painful at times, I'd recommend it getting repaired.
Okay, got it. And that, again, you'd want to wait till you're done having kids?
Yeah. Well, actually, the umbilical hernia is something that could be done before that. Because, it's all about kind of weighing risk and benefit. It's like, what's the risk of me having bowel problems? That's something that can definitely be repaired separate from a tummy tuck. So you could do that before. Okay.
All right. So as a personal trainer, I know that you can tighten loose skin the leaner you are. Or at least the appearance of loose skin. Like when I was competing, I noticed that a lot of my loose skin appeared to be tighter the leaner I got. But some people have, when they lose a significant amount of weight, it just doesn't matter how lean you are. You still need surgery if you want to get rid of the loose skin. So how do you know when you need surgery or if you lose weight, if it will tighten up?
Yeah, that's a really good question. And I see that a lot as well. People come in because it's so awesome to see people who have worked so hard and they really get toned and everything, but then that stubborn skin hangs. So, the skin itself, though, there's a lot of factors. So it depends on your age, how much weight loss you actually have had. And so these are all things that I talk to patients about. And then we actually examine the skin and say, look, it's possible the skin could be tightened with a little bit more exercise, or, it actually would need surgery. So it's hard to, there's not like a specific number, I would say, but it's going to be more individually based. But really, I mean, if you look and you have hanging skin, it's unlikely that the hanging skin will ever really shrink back down,
Yeah.
And so the common area would be like around the belly and, the breast and all that.
Yeah. So what about the difference between like a cool sculpting to try to like tighten the skin versus, a tummy tuck? Does it just depend on how much skin you have to lose, or?
Yeah,
I know
exactly.
you talk about the difference between like a mini tummy tuck and an actual tummy tuck. I know there's different levels.
Mm-hmm. Yeah. So this, one good thing when you meet with a surgeon, or, let's say you're having a consultation with someone, I try to give the whole spectrum to the patient. I say, look, there's non-invasive stuff like cool sculpting, like you mentioned, right? It's going to address a little bit of the fat and get a little bit of skin tightening, all the way to the other end of the spectrum, which is like the full tummy tuck and liposuction. And everything in between, like you mentioned, mini tummy tucks, hybrid mini tummy tucks. There's even some nice devices like Renuvion that help tighten skin that don't require, any cuts. And so there's a whole spectrum. And so it really is kind of individually based, but there's definitely an option for everyone. And so my goal is to, get you the best result, but the least invasive as possible,
Yes. Yeah. So I know that a lot of clients were asking, like, some women are super, I haven't had a C-section, but some women are really uncomfortable with like the flap of skin that hangs over a C-section scar. What would you suggest for them? I guess that's probably individual on like how severe it is.
Yeah, no, I've seen that quite a bit. So, and I tell women we discuss this. Those C-section scars are different because that goes all the way down. They went all the way down through all your muscles and everything to get down to the baby, right? And so that scar a lot of time is very tethered. And so that's why when it gets tethered down into the fascia, you get that shelf of skin above it because that scar is just stuck. And so the only real way to address that is either what's called a scar revision. So you can actually revise a C-section scar. But a lot of times as part of a mini tummy or a standard tummy tuck, all that is removed anyway. So it's addressed at the same time. So it just depends on what your needs are. Like if that's the only thing that bothers you, a little of the skin, then that could just be a small scar revision. That could be done while you're awake. You just numb it up and we could fix that.
Oh, that's good. That's good to know for them.
Yeah.
Oh, good. Okay, so let's talk about implants. I know a lot of women that I train have implants, and one of the main questions that I get is, can you work your chest after you have implants, or do you have to stay away from lifting your chest?
I get that a lot too. So when I first started, I said, oh, you're fine. Go ahead and do whatever you want to do. But I'll be honest, as I've seen more and more women who are fit and are, exercising their upper body, and then I have women come in, have had surgery a long time ago and their implants in their armpits. I've just really come to the conclusion, like, I think if you really want to be careful and take care of your implants, I do not recommend heavy pec workouts, because it really, the safest thing, kind of the standard of care nowadays, is to put the implant underneath part of your pec muscle. That keeps the risk of scar formation the lowest. But at the same time, if you can imagine, if you have something underneath your pec and you're lifting, it's going to pull it out to the side. And I think no matter how good of a surgeon you had, you can't overcome the strength of the pec muscles. So I really do think it's important to be really careful if you're very active to not do so much with your pecs.
Yeah. I've seen people who are fit, like who compete, and I feel like their implants are always pulled out really far.
Oh, yeah.
So that makes sense.
So, so we do talk about it. In some patients, we would consider putting the implant above the muscle, but then you run the higher risk of scar formation. And, especially a lot of women who are very fit have very thin skin. And so the implants look very unnatural. Yeah. So it's just sad. There's no real perfect answer, And so I discussed with women. I said, look, if you want to have great looking breasts, it's unlikely you're going to have really big pec muscles. You're going to have a trade-off there somewhere.
Yeah, definitely. That makes sense.
Yeah.
So, along with getting implants, do you feel like, can women get them before they're done having kids? I know people know that like you can breastfeed with implants. Would you suggest that women wait till they're done having kids, or do you think it's fine to get them and keep having kids?
Yeah, I think as long as, and this is what I discuss with all my patients, as long as you're aware kind of what can happen if you have implants between kids. And there's two main things. One is that implants most likely will not affect your ability to breastfeed, like you mentioned. So most women can still breastfeed. And then two, it's a little unpredictable. Once you have implants in and then you have another child, if you are the type of person that gets really large breasted, and fills and gorges a lot with kids, it may stretch out your skin more and you may need a lift later. So I do tell women that, it's okay to have implants, but your skin may stretch out more than normal and you may need a lift later, but they may need that anyway. So, it's just something that you have to be aware of.
What if women do need a lift and they want more kids? Would you suggest them waiting till after they're done having kids? Or
I probably would.
Okay to do the lift?
I would probably say wait. I mean, you can always do touch-up lifts. It really depends on how bad of a lift you need and if you're willing to do another one. It's kind of like, it's similar to tummy tucks, but at the same time, like tummy's a little different because you're kind of putting muscles back together that are going to be totally ripped apart. With the breast, you're going to have some stretch. It's fine, I think, as long as you may need a touch-up lift to get a lift at the beginning.
Yeah. So do you guys, do doctors still say that you have to replace your implants after every 10 years?
Yeah, so that came up, several years ago because a lot of these companies have 10-year warranties on their implants, and so the FDA recommended that you change it every 10 years. These newer 4th and 5th generation implants, we call them, their warranties now are for the lifetime of the patient. But I still tell patients, and this is what we advise, is that they're not permanent devices. So even though you have a lifetime warranty doesn't mean you should keep them in for the next 70 years, So what I recommend is, it's usually between 10 to 15 years. But if you start the FDA recommends that you get an ultrasound to look at your implants after the first 5 years. And if you do the ultrasound every few years after that, and if they look fine, you can keep them. I mean, I've had women come in, they've had them for 20 plus years, 30 years. So as long as their maintenance
wrong, just if one's smaller, or how do you know when you do the ultrasound if you need to replace them?
Yeah, so the ultrasound nowadays, these high resolution ultrasounds, they're great. They can see if you have a silicone implant, they can tell if there's a small crack or a rupture in it. These newer implants, they're all this gummy type of implant, meaning the gel inside is one material. So it's not like it leaks or goes anywhere. It's all one material. But the ultrasound can pick that up. So if you didn't feel any difference and then the ultrasound picked that up, then you would just get it replaced at that point.
Oh, that's cool.
Yeah.
Okay, so I know you probably get this question a lot, but what are your thoughts about implant illness?
Yeah, that's a huge topic. And even in the last, especially the last few years, it's become very prevalent, right? Both in social media and Facebook groups and things. And a lot of women who are concerned that their implants are causing an illness that, that otherwise can't explain. My personal opinion is I think there is something to it. I think that, on some level, certain people, not everyone, but some people are somehow more sensitive to whether it's the implant shell or the material, whatever, or the body itself just doesn't like having something foreign in it. The body reacts strangely. I would say for the most part, though, it's less common than I think that it's out there, but it's definitely a thing. And I really, at the end of the day, I'm an advocate for my patients. If they're concerned at all that their implants may be causing them health issues, then I take that seriously. And I think most surgeons do. And we want to make sure, our patients are happy and healthy. So we would do whatever it takes. And if it meant taking out implants, then we would do that. But I'd be honest, I've had one patient in the last 2 years that I've treated for that. But I know some surgeons treat it a lot. So it can just vary.
That is interesting. I have heard that if you have a pre-existing autoimmune disease, then it might bring it out where maybe you don't know you have an autoimmune disease, but since you put something foreign in your body, your body tries to fight it, and it can bring that out where maybe it was dormant. But people who don't have that are fine, and it's not an issue. So I think, I mean, I know I'm not a doctor, but I think, like you said, most people are fine. It's the, sometimes, like you said, your body can just not like it.
And I wish we just knew ahead of time. I wish I could say, you know what, like, you're more likely to have problems. That's not it. So I do go through my patients' histories in detail, and we talk about family history of autoimmune diseases and their own history. And at the end of the day, there are other options besides implants for some patients if that's a concern. And so I always will talk about that. So things like fat grafting.
Yeah. Can you talk a little bit about fat grafting, like what the pros and cons are about doing that versus an implant?
Yeah. Fat grafting is wonderful. And I think it's definitely picking up more so now than in the past. I think a lot of it is because of this. People are trying to find alternative ways to augment a breast. I mean, I think in the end of the day, if you could have a nice round breast with your own tissue, that makes way more sense than using a foreign body. The only thing is you just can't get the same look with fat grafting that you can with an implant. And so that's where, it's very individualized. Some people want very rounded breasts, and that just can't be achieved with fat grafting alone. And so that's what an implant's for. But there's combinations. Fat's great because it's your own tissue. If whatever fat survives is always there. And so it's been shown to be safe. And so it's a great tool. I do combine it sometimes. So I'll do implants and fat grafting, especially for women maybe who have a little bit wider cleavage. Some women just have naturally a wider sternum. And so fat is great to kind of soften that, or even just soften the top of an implant to make it a little less, gumdrop looking on your chest.
Yeah. I love that. I love your work. You're very, very good.
Oh, thank you.
I have one more thing I want to touch on before we end, and that is how I feel, and I know we talked about this before, but how important it is to have like a stable emotional state and I guess kind of a stable mental outlook on your body before you choose to get surgery, because I've seen so many times like clients or friends or just people I know where they think that will make them happy, and it doesn't, after it doesn't make them happy. So kind of doing the self-work before you get surgery to make sure that you are not relying on the surgery to make you happy. Have you seen that before, or where people maybe get carried away because they're kind of looking for that happiness through surgery? Or do you have anything to say to that?
For sure. Yeah, no, I'm same page as you. Plastic surgery is not the fix for your emotional state, or it is not going to provide you something, that you may be lacking in other areas. It's definitely, I think, like you said, it's all a health thing. And so coming into this, that's part of, the process too. When I interview patients is that, they're interviewing me to be their surgeon, but I'm also interviewing them to be my patient. And at the end of the day, if someone's not ready emotionally or whatever, or even physically, then, we want to do what we can to help them get to that point. So just like if someone, is trying to lose, let's say, another 20 pounds to get to their goal weight for surgery, it's the same thing emotionally. If they're thinking that this is going to cure all this stuff, then we really have heart-to-heart talk and make sure, we're doing our part before they have surgery, because I want them to be happy, but also we want to make sure that their emotional well-being is well addressed.
Definitely. This was so helpful. You answered all the questions that my followers and clients had asked. So,
awesome.
I'm so grateful. Thank you. Do you have any other last words that you want to leave us with?
No, Brie, I really appreciate you. Thank you so much. I think what you do, your Body by Brie Fitness, is awesome. Like I told you, my sister does it. I have friends that do it. You're just very inspirational. I love what you do and helping other women, helping the community. So thank you. Thanks for thinking of me. If you're ever in town, let's do a TikTok together, because that's one of my favorite things to do. Come by my office.
Definitely. That'd be so fun. Okay, great. Well, thank you, Dr. Chittister. I will link Dr. Chittister's Instagram and website and everything in the show notes. If you want to find him or talk to him or schedule a consult, you can do that. And we will talk to you later. Thank you so much for joining us.
Thank you. Bye, Brie. Bye, everyone.